Okay, hi everyone. Today is 1st of April 2025. My name is Severyan Dyakonov. I'm a history researcher postdoc at Carleton University, and we are having Yipeng Ge. Yeah, you can present yourself.
So my name is Yipeng Ge. I'm a family doctor and a public health practitioner based here on unceded, unsurrendered, traditional Algonquin Anishinaabe territory, also known as Ottawa, Canada.
Yeah, so I think people would know what you are going to talk about. You can just start saying when the problems began. I think it's in the fall of 2023.
Yeah, so in the fall of 2023, the University of Ottawa, where I was training in public health residency, immediately suspended me from my training in public health medicine, where I was also studying the settler colonial determinants of health, understanding how people's health, Indigenous people's health here in Canada, here on occupied Turtle Island, is affected by colonialism, and I also studied the same impacts in Palestine. And I was immediately suspended in early November 2023 for social media posts pertaining to Palestinian human rights and human rights that should be afforded to everyone in this world, particularly people who are under occupation and oppression. And the university ultimately investigated with their own professionalism subcommittee, and they didn't find anything to maintain the suspension. In fact, they lifted the suspension immediately following that investigation. They even recommended that the university apologize, which they haven't, and they even recommended that the university look at the role of interim suspensions in cases like this. Yeah.
But if they apologized, would you come back? Do you think to come back?
Yeah, I mean, I had multiple conversations with the people that suspended me. The dean of medicine, the senior vice dean. I met with them directly following my reinstatement to figure out a path forward within the institution. And they really couldn't really meaningfully find a path forward to kind of repair the harm. And part of that is actually to acknowledge the harm, and they couldn't even do that. They really said, we feel like we have done nothing wrong. When the act of putting an interim suspension in place to kind of question my ability to take care of patients, to question my ability to function as a public health resident, was really egregious on the basis of social media posts about Palestine. And it's a manifestation of anti-Palestinian racism to critique my ability to be able to work in public health because I support Palestinian human rights and Palestinians' rights to self-determination and liberation, which is something that should be afforded to all peoples. Yeah.
So you just left the university and you had no contact with them after?
Yeah, I left the university later on in June of 2024. So a few months after they reinstated me. And that was because I tried within the institution to find a path forward. They welcomed me back with open arms. And there were even people within the faculty. In fact, the person that called me 8 o'clock on a Sunday morning in early November to suspend me, to tell me that, I'm not welcome back into the institution. They later came back to me and said, would you be interested in like looking at our professionalism policies and social media policies to make it so that other residents, other learners within the institution feel more comfortable about how to talk about health advocacy, when it was exactly their like racist actions to suspend me that caused, I think, a lot of people to be fearful of how do you talk about Palestine without this fear of someone coming after you because of social media posts.
And then were you part of any humanitarian action before that, or you joined it after?
Yeah, I was primarily like still training in public health medicine, so I didn't really have a lot of formal experience in humanitarian work. During my master's of public health at Harvard, I did spend 3 weeks in Poland thinking about and studying and researching frontline humanitarian negotiation. And that was related to the Russia-Ukraine war. And it was more like from a research kind of background, a little bit theoretical, but obviously also very much in practice on the ground in Poland and at the borders of Poland and Belarus and Poland and Ukraine. But working as a clinician, as a primary care doctor, I hadn't done that really in a setting like Gaza or Palestine before. I had visited Palestine for the purposes of understanding apartheid and occupation better. I have worked in primary care and public health in contexts like Nunavut in the north, Canada's remote north, and I've trained in medicine throughout Canada because of my medical training that's taken me to do electives and observerships in many parts of the country, including underserviced, under-resourced, remote communities, but nothing compared to taking care of patients during a genocide in Gaza.
When did you decide to go there?
Ironically, it was the experience of being doxxed and then suspended by the university that I was brought closer to other physicians that do a lot of humanitarian work and think about capacity building work in Palestine and in Gaza specifically, and being in touch with these kinds of amazing colleagues. I was thinking about how to continue to center the people of Palestine as they were experiencing a genocide. And one of my dear friends and colleagues, Dr. Tarek Lubani, offered this, opportunity because they were looking to build more capacity to bring in medical doctors, surgeons, because the Gaza Health Ministry in October of 2023 reached out to the international community through the United Nations, through the World Health Organization, to bring in more doctors because their doctors were being, the healthcare system was fully under attack in October, in the early days of October 2023, but also many doctors, Palestinian doctors, were being killed along with their families. So they needed the additional supports, and it was through that call that many different groups, including Dr. Tarek Lubani's group called GLIA, that previously operated in Gaza for many years, set up coordination with the World Health Organization through something called emergency medical teams to be able to send in doctors, nurses, healthcare workers. And so the conversation kind of took place in late December 2023, early 2024, and quickly we realized it was possible, and we got approved. And so I was on the first medical mission with the organization called GLIA to enter in February of 2024.
So so you contacted these people, they decided to join this program, and they said, okay, this is the date, we all fly together, or how was it? Or you joined them, or?
Yeah, I mean, it was a bit confusing as to when we would actually go, because it's such a fluid situation that it wasn't clear if it was going to be like in the next few weeks or the next few days. But I remember it was a very short turnaround, maybe like a week and a half, 2 weeks, where I found out, oh, we have an entry date through the Rafah border crossing, the border crossing between Egypt and Palestine, Gaza. And once we got that approval, we had to quickly make our way to Cairo, Egypt, to be able to meet with the World Health Organization, be briefed by them, and to make the necessary arrangements so that we could also bring in medications and supplies to be able to be a little bit helpful on the ground, even though it's I remember saying after coming back, it was like you're kind of like shuffling deck chairs on a sinking ship. That's what it felt like. But yeah, it was a very last minute. Everything happened very last minute.
So you arrived from Canada to Cairo first?
Yes, yeah.
When was that?
That was in early February. And yeah, I can pull up the exact dates.
I don't think it's
okay.
That's necessary.
Okay.
So you stayed in Cairo for some time, and then you had the dates to go, or how
it was. We didn't have that much time in Cairo. I think I arrived on a Thursday or a Wednesday, and we only had a few days, and then we planned to enter on the Monday. So I think it was just a weekend.
And how many of you? How the team
I went with 3 others. So another family doctor, a primary care doctor, a nurse trained in emergency medicine, and the 4th person was the son of the other doctor that I was with to help translate.
Yeah, and you had one car, or how did it look like? Yeah,
we had arranged with the like Tarek Lubani and his partner in crime, Dorothea Gucciardo. Both of them were based in London, helping coordinate all of this for us. Like they were our point people, and had that relationship with the World Health Organization to be able to put our names on the list so that we get approved by WHO, approved by the Egyptian authorities, the Israeli authorities, and the Palestinian authorities. And so, yes, it was the 4 of us. And once we got our approvals, we were in Cairo together gathering supplies like medications. I remember, infant formula, diapers, chocolate, coffee, the things that are very hard to find or impossible to find in Gaza because of shortages, and obviously bringing food and water for ourselves as well.
Do you have like a truck, or how many cars was in your team?
We had a driver. We hired a local driver to help us with running all the errands, but also bringing us from Cairo to the Rafah border. His name was Kareem. He was so wonderful and helpful by, helping us run all these errands, but we didn't have like a truck. It was just like a sedan, a car. And then on the day that we went and made that journey from Cairo to the Rafah border with the United Nations convoy, we had a second car to be able to bring the multiple bags we had. I think it was something like 16 bags, suitcases full of different medications and supplies that we brought in. And we had two people. So the four of us, we split into two people with one driver in one car with lots of bags, and then two people with another driver, lots of bags.
And when it was the day to go, did the receiving side, they told you something to prepare you what you're going to see, or it was already you were understanding the context and they didn't inform you about anything specific? Or?
I think it was, I forget exactly if it was the Saturday or the Sunday, but one of the days we had to meet with the World Health Organization to debrief, what the process would look like not only the travel from Cairo through the Egyptian Sinai Peninsula to the Rafah border, but also what it would be like working in southern Gaza, working in Rafah. And essentially, we went through really intense and scary situations where, for example, if the hospital or the clinic were to be under attack by Israeli military, we talked about having like a grab bag of everything that you might need to be able to survive on foot if you had to flee. And that the United Nations and the World Health Organization were not going to come save us if we needed saving. Like, it was like we are responsible for ourselves. Of course, if we let them know that we are in trouble, though they can try to do what they can, but it was an acknowledgement that we would be on our own, as everyone is on their own, because there's no safe place in Gaza, no meaningful safe place, even though they say there's like safe humanitarian areas, but then Israel still bombs these areas. And one of the things that the scenarios of like what the World Health Organization people were telling us was like, if it all if there's like a really bad situation, right? If the military is like shooting, you don't feel safe, there's bombing, then you take your grab bag and you just get as close to the border as you can going south, and that you just shelter in place, near the border. So we were already primed with these kinds of scenarios.
Okay, then we can go to the exact date how you came to the border.
The morning of, it was very early. I think it was 4 or 5 in the morning when we all got together in central Cairo with the United Nations convoy, and there were quite a few cars in this convoy, bringing in lots of different kinds of health workers, but also humanitarian workers from different organizations, like United Nations organizations. And it was quite strict, where the first car in the convoy, led by the head of mission, the United Nations official, had all the documentation for all the people in this convoy, and even the cars all had very specific places in the convoy. Every car needs to be behind the next car. There can't be any moving around. And the journey took pretty much all day to get through the Sinai Peninsula, because there's lots of military checkpoints set up by the Egyptians. Some of these checkpoints we would actually wait quite a bit of time. other checkpoints we would be waved through pretty quickly, but our documents had to be checked quite a few times throughout that journey. I think we left Cairo in like 5-6 o'clock in the morning, and we arrived we arrived at the Rafah border probably like late afternoon, and then I remember like even being at the border, it took a long time to process all of our documents, and then finally when we like arrived at the place that we were going to stay in for the night in Rafah in Gaza, it was like 6 or 7 p.m.
Yeah, I would come back to the actual border. When you came, who were the authorities that cleared you, that let you inside?
Yeah, when we got to the border, we actually had to like leave our drivers. So the drivers were not entering, so we had to take all of our bags off of the cars, and they would be loaded up into little trolleys, and the trolleys with us and our bags, we would have to walk on foot to get to like a border screening stop where we went through x-ray machines ourselves in our bags. There would be questions around like the things that we're bringing in, the maximum amounts of like cash that we're bringing in, and then we just waited for a long time, like a few hours, to get our papers processed by the Egyptians. And then once that was processed, we went onto a large bus, like a coach bus, loaded up all of our luggage on, went on the bus ourselves, and drove for a very short distance, maybe like less than 100 meters or something. And then we got to the Palestinian side of the border, and we all got off, unloaded all the bags, and we were able to meet some of the people that were waiting for us on the other side of the border.
Did you see any signs of war situation already there?
No, not at that time, not at that border, because there was no Israeli military presence at that border at that time.
And when you were going to the place that you were supposed to come, did you start seeing war?
No, not when I was there, because this, if we remember, like February of last year, this was when the Israeli military was not invading Rafah just yet, and did not have a presence at the Rafah border itself. In fact, like the conversations we had with the United Nations, with the World Health Organization, was really like around the Israeli military presence. Like if they are close to you, or like that is dangerous, right? So yeah.
So you arrived the night and then started working the next day?
The next day.
And how did it look? You lived like in an apartment of some people, or?
Yeah, there was limited to no housing, really. Mm-hmm. So when we arrived, we were met with some representatives of the Ministry of Health who arranged for us to temporarily stay at the Emirati Maternity Hospital, the major maternity hospital in the south. And we stayed there just the first night. So we stayed in a room that had some extra, it was like an office room, but also had some patient beds and like ultrasounds. It was like a really small storage room, but we were able to stay there for the night. And then the next night, and then all the nights after that, we stayed at the Tal Sultan Primary Care Clinic in a room that was on the clinic premises. yeah, so we were able to stay there.
So they ask you to receive patients, or what service did they want?
Yeah. Initially we were talking about going to the Nasser hospital in Western Khan Yunis to work in the emergency department, but that hospital was surrounded by tanks, and later during that week it was besieged by the Israeli military. So we ended up staying in the primary care clinic and working in primary care for most of the time. So the next day, the first full day we were in Gaza, we worked at the primary care clinic seeing patients. So they kind of brought us over to the there was like a additional part to the clinic that was built by other humanitarian organizations called Med Global and Human Concern International. Like this like extra section of the clinic was built in this way where you could see more patients there. So that's where we spent most of our time. And later on some of the days, we also went to another primary care clinic that was like that was out of a school that sheltered thousands of displaced families, and that was called a medical point, and it was run by Med Global, and we also worked out of that clinic as well.
When did you see that there was something extraordinary happening?
I think I knew it already. I knew it already because I was speaking to colleagues about how to prepare to work in healthcare under these circumstances, and they said, there's nothing that can prepare you to witness what's happening on the ground. And I think they're very right, because it's really like witnessing this kind of overt genocide that is so in your face. And I think in my mind, when I arrived, I was thinking I might see patients who would suffer from traumatic injuries, like being crushed by a building, having shrapnel wounds, burns. We did see some of these things, but the majority of things that I was seeing in the primary care clinic were chronic diseases, like patients who had diabetes and heart disease and high blood pressure, and none of these things were being appropriately treated. But also a lot of children that were malnourished and starving and dehydrated, and very little options to be able to help them because of the limitations on clean water and food, and also decent shelter. So many people were just living in these tents that were not appropriate for really protection from the elements. I remember taking care of young infants or babies, and their clothing was damp, and that was because it rained the day before. There were massive outbreaks at the time of hepatitis A, and there's no lab diagnosis of hepatitis A because there's no functioning laboratories, but you could tell because many patients had jaundice, yellowing of the skin, yellowing of the whites of the eyes, and they also had many symptoms like vomiting, diarrhea, and abdominal pain. And many of these patients, you just you don't really know how to help them, because you know that the best way anyone can be helped is for the occupation to end, is for the trucks with all of those things that need to enter, the trucks need to enter. I remember when we were entering, you could just see all these trucks lined up, and none of them were getting in. Very few were getting in. Trucks would have expired goods when they even got to the beginning of the line and have to throw these goods at the border, throw them away. It's a combination of all of these things, right? That make you understand that this is a very extraordinary thing to be happening that is just so unjust.
And how did you, it's strange to say, feel about, did you sleep like the first day?
I think it was hard to sleep initially, but I do think the first night I did fall asleep because I was so exhausted from the journey to enter. I think I need to say, the night before entering, there were massive bombings in southern Gaza. In the U.S., it was the night of the Super Bowl, and so what we know is when there's like a major event in the U.S. and lots of media coverage covers said events, Israel has a habit of increasing the bombings in Gaza because the news already doesn't do a good job of covering what's happening in Palestine, but they certainly do a worse job when there's other things that they're covering. And so before I even went to sleep, the night before going into Gaza was the belt bombing in Rafah, and this was when so many people were killed, including like Sidra Hasuna. She's I believe 7 years old, and she was killed along with her sister, along with so many others. And there was an image of her body being disfigured and mangled, and it was just hanging off of a wall. And and that happened like right before I tried to go to sleep. I don't think I really slept that night because we also had to get up really early to go meet the convoy. And because of that bombing too, there was talk with the convoy that we're not sure if we were even going to be allowed to enter. There was a chance that we would not be allowed to enter and that we would be turned away, or if we were to enter, that it's a very, very dangerous situation. Like, we already knew it was a dangerous situation, but it just felt, because of that bombing that night, that it was going to be a really bad situation. And but we made it in, and I think it was just a complete mix of many different emotions, and partly also because when we were first received and put in a room after like a short ride from the border in an ambulance to the hospital, the first thing that the Palestinian healthcare workers that received us did was they put water and warm food in front of us to like encourage us to eat. And I remember when that happened, my immediate reaction was to cry. And then it felt really inappropriate to cry because the things that they had to go through and they still were going through, for them to, have to console me, not, like, it just felt like, yeah. So I quickly wiped away my tears and thanked them, and we spent some time together, and then a few hours later, yeah, I did fall asleep, but in the distance you could always hear bombs, and you could always hear drones. So the nights that followed, some bombs would feel like they were very close. One of the evenings I was on the phone with Dr. Tarek Lubani, and a loud bomb went off, a cluster of bombs, and one side of the clinic, I think the north side of the clinic, like shook, and so you could just like feel the vibration. And I'm glad I was on the phone with him, and because he could, kind of calm me down a little bit and just tell me, I should go back with the others. But then there was another night where I would wake up and it was like maybe 5 or 6 in the morning, and you could hear the bombing. Like the bombing woke me up. And then of course there's just nonstop surveillance drone sounds all the time. And so as much as it was hard to fall asleep, I also think the amount of work we did throughout the day, the amount of like psychological stimulation throughout the day as well, at times you just kind of collapsed in the evening as well. And
it's strange that in these days that you work, was it like a very routine work every day was very similar, or it was always something different? Can you just describe this normal day?
I think it was a bit of like an exceptional experience as well, because we were the first group to enter with this organization, and so we were very much figuring things out by figuring out what a normal day could look like. But because we were figuring things out as we went, every day was kind of a little bit different, where we would spend maybe a solid morning working in the clinic, seeing patients back to back. Sometimes I think it was like up to 60 or 70 patients in a morning. And then we would have like a quick lunch and then try to keep going in the afternoon. But sometimes there was, on 2 occasions we went to the European Gaza hospital in eastern Khan Yunis, because we brought in anesthetic medication, and it's not really helpful to have anesthetic medication at a primary care clinic, maybe for like minor procedures, but really this is better used in a hospital. And so we had to get to the hospital. So we were trying to arrange for these kinds of things. There were also coordinating meetings at the United Nations like headquarters, and since we were just figuring things out, sometimes we would also attend some of those meetings in the morning to be able to understand where the international healthcare and humanitarian aid workers are placed, where there's greatest need to be able to also inform the future delegations that were coming to help replace us, and so to build some of those relationships. So I'd say like each day was fairly different from one another, but one thing that was consistent was we were staying at the clinic that we worked at. When we had some kind of downtime, we would just work in the clinic, and because from the room that we stayed in and exited, it was probably like a very short walk in the clinic to where we could start seeing patients, and so it's a very, very, very small like location, but like thousands of people would come through the clinic every day. Like it would be super, super packed, and sometimes you could like lose each other, but myself, I really stick out, being someone who's like East Asian, Chinese. And I remember one day, like I was seeing patients with another Palestinian medical student, and the other team members were looking for me, and so then they had folks kind of like go around and check all the rooms, and they were just looking for the Chinese doctor, and they were able to find me.
I want to ask about patients, but did you see lots of casualties from direct military action, or the overwhelming impression was that it's the destruction of infrastructure that created this amount of patients?
Yeah, because I was working at that primary care clinic, and then on some days we went to another primary care clinic that was based out of a school that was housing thousands of displaced families. It was called a medical point, so it's not like a full clinic, but it just offers some kind of services. Because I was working in these primary care settings, I wasn't seeing the patients that would be immediately like bombed or hit by gunfire. Those patients, if they survived, they were somehow transported by donkey cart, by car, by foot, by others who rescued them to a hospital. And primarily the hospital that was really functioning in the south at the time was the European Gaza hospital in eastern Khan Yunis. So for us to also get a better sense of that, we did visit the European Gaza hospital on 2 different occasions to be able to deliver medications and supplies, but also to learn about some of the patient cases. Like we visited the intensive care unit in the European Gaza hospital, and there were children like aged between must have been between 6 and 12 in the intensive care unit who had gunshot injuries to the chest, to the head, sometimes full burn injuries from explosive bombs. But the gunshot injuries to the head and chest were particularly worrisome because these really seemed and appeared to be targeted killings of children. We were not the only people to have seen this happen. This has been now well documented by hundreds of healthcare workers who have taken care of direct patient care of these kinds of patients. We didn't directly care for these patients. We met some of them in the intensive care unit to be able to understand those more traumatic, physically traumatic injuries. But because we were working in the primary care clinics, the things that we were definitely seeing was a lot of follow-ups for previous surgeries, like wound care, burns from not only the assaults from the Israeli military, but also people were trying to just stay warm and cook with fires, open flames. So some children would get burned that way. And of course, severe malnutrition. The World Health Organization recommended us to screen for severe malnutrition using a measuring tape. And you use the measuring tape and wrap it around the upper arm of a child to figure out if they were severely malnourished. We didn't have measuring tape at the time, but there were some patients that I didn't need it for. So I remember a patient who was quite young, between the ages of 8 and 10, and he was being carried in by his mother because he was no longer walking from severe malnutrition, and I could wrap my index finger and thumb around their upper arm and their lower leg. And this child was not a unique child as well. There were many other children like this. There's something called rickets disease, severe vitamin D deficiency leading to abnormal bone growth. And I think we saw suspected 4 cases of rickets disease in the course of a morning. And these are very, very severe cases of malnutrition, for starvation, right? And so, and I mentioned earlier, there was also a lot of gastrointestinal infections, some of which were probably hepatitis A because of a lack of clean drinking water. there were also lots of respiratory infections. Some, of course, viral, but there were some that we were worried about a bacterial infection, so we started to also prescribe antibiotics in some of those cases. But the 2 clinics that we worked out of in primary care didn't have antibiotics when we arrived, and we started to prescribe the antibiotics that we brought in, and we also took inventory of our medications that we brought in to be able to help stock the pharmacies that we worked at, and also take down from the local pharmacists, like at the European Gaza Hospital, at the primary care clinics, to be able to flag for the incoming delegation to bring these medications so that there can be some kind of continuity with what was needed.
So how many days did you stay? Did you know that you would stay for this limited amount of days, or?
Yeah, it was always a reassessment of, we didn't really know if we would be able to enter, to be quite honest. And then once we were there, we were figuring out if we could stay longer, if we would just stay for the week. We ended up all staying for the week because the incoming delegation was coming in, and there's only so much space in the space that we were staying in. I do think, like, I reflect on it sometimes where, I could have stayed longer, and I wondered, why I decided to still leave. I do wish, like, if I stayed longer, I think it would have been a very important experience to if I could have stayed longer, I should have. But there were also commitments that I made to the clinics that I work at here in Canada, and they were also expecting me back. So it was also a challenge to figure out, like, do I just drop everything and keep working? I think a lot about this sometimes. There's a colleague of mine who I was supposed to enter with her in May of last year. I wasn't able to enter because I was, like, waiting in Egypt, and then later she went to Jordan and was able to enter through Jordan. I ran out of time and I came back to Canada, but she's still in Gaza right now. So it's been, like, we're coming up on a year that she's been in Gaza. And so, I think about that a lot. I think part of what I also realized was, as much it was important to keep helping on the ground, I know that what I was doing on the ground was only a drop in the bucket with what people actually need, and what people in Gaza need is, like, liberation, is like an elimination of the occupying military force, an elimination of those structures of violence and oppression that keep them in this, like, position of dispossession and continual also dependence on, like, the humanitarian sector, on aid, and not being able to, like, create and maintain their own sovereign, like, health system that is led by Palestinians. And Israel has done this, like, deliberately by killing, like, an entire generation of doctors and medical specialists who are the ones treating patients, who are the ones teaching medical students. And I think a really important role that I reflected on was to be able to, like, push where I can outside of Gaza, outside of Palestine, to highlight the genocide and the complicity of other states, including Canada, where I am a citizen of and need to be able to end these ties of complicity and these kinds of war crimes.
When you were leaving Palestine, did they tell you something specific that you should tell something to the world, or they didn't? Or the people were not talking about these things at all?
Well, I mean, I still stay in touch with some of the healthcare workers and that I met in Gaza, and they have very simple messages for the world, is that they deserve to live. They deserve to live with dignity. They deserve like all the things that many other people in this world are afforded to, but just because they are indigenous to Palestine, they are on the receiving end of colonial violence and genocide. And they also very much invited me back in a way that was so warm and generous, because they received me and others as guests, right? And they actually were very worried and concerned that they weren't doing enough as guests to bring us in and welcome us, because they would rather that we see their homes, see the places that they love in Gaza, for them to be able to cook proper meals for us, and because of genocide, they weren't able to do any of these things, and that's what they worried about, is not being able to take care of us as guests on their land. And so we talked about, one day we will be able to, celebrate and share time and space together in their homes over a meal, and create some really good memories together. We live in a world, in a society that is deeply sick and unwell, because colonialism, capitalism, Zionism are normalized as systems of oppression that the status quo will choose to maintain, especially in the West. But these things are killing people. These things are the root causes for genocide, not only in Palestine, but genocide in many other parts of the world because of these forms of oppression, namely capitalism and colonialism. And they've dehumanized certain peoples, particularly indigenous peoples around the world, Palestinians included, to not be able to live full, fulfilling lives with dignity. And what Gaza continues to teach us is how to practice and live life with dignity while experiencing genocide. So I definitely learned so much more about life and humanity and what it means to also live in this world, knowing we actually have enough. We don't need much. We just need some basic needs met. We need community. We need to not obviously have bombs dropping over us, but we also don't need forms of oppression. But to kind of create that world, it's also very straightforward. I saw people in Gaza do this, is take care of each other, take care of your neighbors, share when even when you don't even have enough, you share because you know other people have less than you. And so I think I say all this because we're all thinking about how to create a world and societies that are just different than what we're experiencing. And that starts at the local level, like how we treat each other, how do we emulate the ways in which Palestinians in Gaza have been teaching us how to live life with dignity.
Well, I feel actually we can end here, because if you think to add something, but I think it's quite enough.
Yeah, I think it's a good place to end.
Yeah.
Yeah.
Well, thank you.
Yeah,
for
thank you.
sharing.